Did you know that 4 to 6% of the population suffers from ADHD? Were you aware that ADHD does not usually go away and last a person's lifetime? The symptoms a person has and the severity of those symptoms varies from person to person. Children are not the only ones who can suffer from this disorder. Today I plan to tell you about ADHD, which is Attention Deficit Hyperactivity Disorder. Both my son and daughter have ADHD, and I think I might have a little adult ADHD as well. I am also in nursing school, and I feel people need to be more informed about ADHD and the treatment it requires. Let me tell you today what ADHD is, the possible causes, risk factors and symptoms of it, and ways it may be treated. According to the National Institute of Health, ADHD is a problem of not being able to focus, being overactive, not being able to control behavior, or a combination of these. In order for the diagnosis of ADHD to be given to a person, the symptoms a person has must be outside the norm for someone of their age and their developmental level. ADHD also often lasts into adulthood. The symptoms may not be as pronounced as the person ages and is better able to control their impulses. There are some people who actually may outgrow the disorder altogether, but this is not always the case. ADHD has to cause problems with behavior at home or at school or in two different locations in order for it to be diagnosed, and it can be diagnosed in children who are as young as 4 or as old as 18. The causes, risk factors, and symptoms of ADHD may be individualized to each person. The exact cause of ADHD is not completely clear. Some potential problems include the structure of the brain, the chemicals of the brain, and genetic factors. The relatives of children who have ADHD are much more likely to have ADHD or some other mental health issue. Some mental health disorders may also be present with ADHD. The risk factors of ADHD include a blood relative who has ADHD or another mental disorder, certain environmental toxins such as lead, the use of alcohol, smoking, or drugs during pregnancy by the mother, a pregnant mother's exposure to poisons in the environment, and prematurity. Many symptoms are involved with ADHD and its diagnosis. A child must meet the criteria for ADHD according to the DSM that is published by the American Psychiatric Association. Symptoms must also be present before the age of 7. According to the DSM, a child must have 6 or more symptoms from 2 categories. These 2 categories are inattention and hyperactivity, impulsiveness. Some of the symptoms include distractibility, impulsiveness, inattentiveness, and hyperactivity. My son had a hard time sitting down in his class before he got on his medication, but now he's doing much better, he's getting much better grades, and he's able to concentrate much better. There is not a single test that can be used to diagnose ADHD. The DSM-5 is used to help diagnose people with ADHD. The CDC has a checklist available on their website that can be used by parents and brought to the healthcare provider. This is a sample of that checklist. There's also some forms that can be given to the parent as well as the teacher that will help the doctor in diagnosing ADHD in the child, and at the same time prove that the problem exists in 2 different locations. Many aspects of the treatment include medications, education of the child and the parent, and counseling. Medications are a big part of treatment for ADHD. Some of the meds that are used are Concerta, Ritalin, Vyvanse, and Adderall. Meds should not be sent to the school with the child. They should be taken by the parents and given to the school nurse. The parents should be educated about about the disorder and how to make it better for their child. They need to learn how to praise their good behavior and their accomplishments. They need to try to teach the child better organization skills. The child needs to be well rested because fatigue can make the symptoms worse. In closing, may I say that today I talked to you about a disorder that affects many different children and their families. Attention deficit hyperactivity disorder. I told you that what ADHD is, some of the causes, the risk factors and symptoms, and some of the ways it is treated. I hope you learned a little bit about ADHD today and that it is a treatable disorder.